timely, in-depth scientific review. And this evening, Mr. Panzironi, we are talking about one of the most common diseases that can create very important, practically metabolic alterations. We are talking about Basedow-Graves disease practically affecting the thyroid. And so I would like to invite all our audience to watch this video to understand what we are going to talk about.
Basedow-Graves disease, the most common form of hyperthyroidism, a condition in which the thyroid gland produces excessive amounts of hormones causing disorders and symptoms affecting virtually the entire body. It is a disease of autoimmune origin that is caused by a disorder of the immune system and specifically by the presence of antibodies that, by stimulating the thyroid gland, promote volumetric growth and especially hyperfunction.
Here, Mr. Panzironi, this was Professor Luigi Bartolena, who basically explained to us that the pathology of Basedow-Graves disease is due to an alteration of the immune system.
Yes, by now research has confirmed it at length. It is really an alteration of the Th1 and Th2 system that induces an overproduction of antibodies that go to block TSH receptors. This induces a lowering of TSH and, on the other hand, an overexpression of FT3 and FT4.
Actually, Mr. Panzironi, but how widespread is this disease here in Italy?
Unfortunately, it is very widespread. We are talking about 1.5 to 3% of the entire Italian population, so about 1.8 million people. Many, unfortunately, even suffering from this pathology, are not diagnosed, so they suffer from this pathology, and clearly they also suffer from what are the symptoms of the same without, however, having gone to the doctor who has recognized them this pathology.
So our broadcast, as I often say, wants to do public service. It does. And so I would like to show this video to our audience to make them understand what are the symptoms that can make us think we have this kind of pathology. Let's see it together.
The symptoms are the classic ones of hyperthyroidism: palpitations, tremors, nervousness, weight reduction, increased heat production, sweating, increased heart rate. But compared to the other forms of hyperthyroidism, one characteristic of Graves' disease is the presence of symptoms related to autoimmunity, of signs related to autoimmunity, in particular Graves' ophthalmopathy. That is, the possibility that there is ocular involvement, of which protrusion of the eyeball, thus exophthalmos, is the most obvious aspect, and is also the one that worries the patient the most, is present in a fair share of Graves' disease patients.
So, Mr. Panzironi, practically, the video told us about the classic symptoms then of hyperthyroidism. However, in particular, it is found in this pathology when there is a phenomenon of exophthalmos, practically the eye pushed forward, that really seems to be a distinguishing factor.
Actually, the professor was not accurate in his description, because 80% of hyperthyroidism pathologies are called Basedow-Graves pathologies. If anything, it is only 25% of these people who suffer from this pathology who have the problem of ophthalmos, so these eyes that tend to pop out. However, it is actually a pathology that was named that way because it was discovered by two doctors, one in Ireland named Graves and the other in Germany named Basedow.
We actually recommend, of course, always to go to the doctor to get the proper investigations, the examinations, especially when we notice that there are problems that go or symptoms that go to worsen our health. And so let's see together what are the examinations provided for this type of pathology.
The diagnosis is made once the clinical picture is confirmed, highlighted through laboratory investigations, so TSH, which is blocked, FT4, which is elevated, TSH anti-receptor antibody assay, which confirms the etiology, and then thyroid echocolor Doppler, which documents a hypervascularized thyroid with a classic picture, color Doppler, which is called thyroid hell.
So, Mr. Panzironi, the doctor told us that we need to do TSH, FT3, FT4 antibody tests, obviously against the TSH receptor. And then by echocolor Doppler, we check the vasculature of the thyroid.
I have to tell you that really medicine has made great strides in determining the tests or the methods that are used precisely to recognize a pathology, so on. This really should be congratulated, if anything. The problem is that after this pathology is diagnosed, some rather questionable treatment choices are made. And I think especially about this pathology, there is really a lot to be said.
Here, Mr. Panzironi mentioned treatment. We are very curious to understand how official medicine deals with this kind of pathology. With protocols, let's see it together.
There are essentially three therapies for Graves' disease: medical therapy with ethionomides, particularly methimazole, surgical therapy of thyroid removal, and radiometabolic therapy, in which with radioactive iodine the thyroid is sidered. In principle, the first approach is always medical. An attempt is made with medical therapy to re-engage the thyroid in the normal situation. It succeeds, unfortunately, in 30 to 40% of cases, even in prolonged treatment. When the thyroid does not fall into a prolonged and hopefully definitive remission, it will be up to the clinician to decide which of the two ablative options to choose, whether surgery or radioiodine therapy. We have indications and contraindications for both options.
So, Mr. Panzironi, basically we tend to keep everything under control by medication. However, in 60–70% of the cases, it is necessary to resort to surgical removal of the thyroid gland or radiometabolic therapy with radioactive iodine. I would like to know what you think about that.
Look, I went into this method specifically to try to understand what the therapeutic choice was. Well, I have to say that I was puzzled, because in this therapy, you have basically a tablet of radioactive iodine ingested, which then the thyroid absorbs. And then this radioactive iodine basically kills the thyroid cells. However, do you think that during about 25 to 30 days after taking this pill, even the doctors can stay in the room where the patient is actually admitted for very few minutes to avoid excessive radiation exposure? And even the relatives can make very quick visits. Even after 15 days, there are directions even to take the cab. I mean, think how much is, let's say, so dangerous, this pathology, and how this is so much underestimated, as if we don't know that then radiation is one of the main reasons for the occurrence of cancer. Well, I think that as today we almost joke about it, we almost go to screen what was medicine in the past years, where exactly in front we say leeches were used to solve problems, or even electroshock to treat mental illness. Well, I think that this method, this radiotherapy, will be remembered in the coming years as really something that will have to be forgotten.
Panzironi, though, this is a question that I'm asking myself, but I think all the people who are listening to it are asking themselves a little bit. But if basically pharmacology then leads to the removal of the thyroid, is there not another method to prevent or treat this kind of pathology?
First of all, official medicine should ask itself, how is it possible that there are up to 3% of people suffering from this pathology when we get to such high numbers, almost 2 million people in Italy, and then we find at the same time that this pathology is not found in the animal kingdom? Then we should ask ourselves, what are the real causes that induce the occurrence of this pathology? And as usual happens, it is what we eat. It's life series. So once again, those foods that are the basis of the Mediterranean diet, such as bread, pasta, pizza, potatoes, rice, and legumes.
However, you normally, when you point the finger, you also give a scientific explanation. You want to tell us why it is these foods that cause this kind of pathology.
Well, we have explained many times how this diet induces an alteration in the Th1 and Th2 system. Actually, in this pathology, there is a collaboration between these two classes. First, there is an inflammation induced by the overexpressed Th1 system, and then it leads to an inflammation that is shifted to the Th2 system, which leads to losing, let's say, control of these antibodies to such an extent that the production of brake lymphocytes, which are those lymphocytes that really have to keep the immune system tolerant to proteins, is reduced.
Look, however, what is the reason for this practically reduction of these breaks, and thus the loss of Th2 immune tolerance?
There are a lot of interesting studies on the relationship between the alteration of the microbiota, thus the problem of leaky gut syndrome, with the occurrence of hyperthyroidism, because it has obviously been shown that when we eat these foods, we induce an overproduction of bacteria, that this leads to leaky gut syndrome, and this induces an alteration of the immune system, in some cases the two, which then leads to, let's say, an excessive production of inflammatory cytokines. It is precisely these cytokines that, by keeping our immune system on high alert, lead to the reduction of brake production and thus the onset and maintenance of the pathology precisely based on hyperthyroidism.
So thank you in the meantime to Mr. Panzironi for giving us this very important information, and it's the moment in our focus. It provides right now for a guest, and so I would like to call Mrs. Antonella Misciocia here next to us. I invite you to have a seat, and we would like to talk obviously about your history with this type of pathology. So you began to have a problem with Basedow-Graves disease in 2010. How did you realize you were suffering from it?
By chance, one day, while I was working in the office, my blood pressure goes up, fast pulse, hot. In the middle of winter, I was sweating. I measured the pressure. More than the pressure, it was the beats. They were worrying. It was 140 beats per minute. Yes, yes, yes.
So twice as much practically.
After this episode, forget in short about this. Then one day, suddenly, I wake up with my eyes swollen so wide right out of their sockets. Even this one in particular just looked like facial paresis.
You worry and go directly to the ophthalmologist, then?
For the eyes, I go to the ophthalmologist. He examines me. He says, "Madam, for me, this is not a vision problem. This is a thyroid problem. Do the tests, because it is definitely a thyroid problem."
Do you do the analysis, and what does it say about this?
The ophthalmologist gets it right.
That it is a thyroid problem, so go to the endocrinologist.
Endocrinologist diagnoses me with hyperthyroidism. Frank with Basedow's disease, which is an overworking thyroid, which at the time, at least, he told me works for 3 times as much.
So basically, we are talking about a low TSH with a skyrocketing FT3 and FT4, basically. Definitely start a drug treatment. What?
Then, first of all, she gives me a diet based on insulin carbohydrates.
Only carbohydrates?
I found out later that they are insulin, mostly whole grain. Then he gives me the therapy 3-tapazole for thyroid, and plus he also gives me cortisone for my eyes because I had pre-diabetes, and so he also gives me cortisone for my eyes.
Look, obviously we are talking here that you started in 2010 this drama. We come in 2016. After you met more endocrinologists, how many did you meet? Here comes the last one, let's say, the last one in the series. What does this last one tell you?
4 or 5. The last doctor who was the most honest, also I must say, because he told me right away, the first time, "Ma'am, you have to solve this problem. You can't go on tapazole because tapazole is a toxic drug. You can't take it for life."
So what does he do? Does he take away your medication, this doctor?
Anyway, the dosage he had to see the right dosage for me, and then the solution to this problem. That is, the solution to this problem were 2 paths to take, either surgery or radioiodine therapy. Only the surgery was not in my case because, since it is not a thyroid, does not have nodules, it was not the case to operate. So the right therapy for me was radioiodine therapy. I do a preparation first, take out the tablet, do a month diet,
so does it prepare you for
a low
this therapy?
iodine diet.
And then in September 2017, right, he does this radiation therapy. What kind of side effect did you have?
Then the most obnoxious side effect was severe back pain, and then bad mood, bad mood.
He felt very irritable.
Irritable, yes, yes, very much.
Look, I know you then had several checkups, obviously after this radioionotherapy. And what did you find about both TSH and...
TSH for 2-3 months seemed to be coming back until December. So in January 2018, again, the TSH lands.
At this point, the doctor tells you that he should do another radioion therapy session.
He had already anticipated it to me, really, that if it didn't work the first time, I would have to repeat it a second time. We were hoping for it, though, in the first one.
In July, August 2018, they called her back because she was ready. The option was available.
Had already put me on the list to go and do it again.
And so, in July, August, they call you to do the second radiotherapy session. However, what do you do?
I stalled a little bit because since I had my checkup in November, a little bit because I was afraid, honestly, to do it again. I stalled a little bit, waited for November.
Because he was going to have a checkup again in November, and so he was hoping for some better solution. In the meantime, however, his mother comes out.
He gives me the drug back, I should point out. He gives me tapazole again, what he never wanted to give me back. How much dosage?
How much
back
dosage?
To 3 again.
Do 3
we went
a day
from
again.
1, 2, and then 3.
This is where your mother comes out, though, because she confides, as all children do, they confide in their mothers. She confides in her mother and tells her about this.
My mother, how she heard that I had to go for metabolic again, because my mother is hardly wrong when she says something. Here, like all moms, she worried. So at some point she tells me, take out the carbs. I have to take out the carbs. What do carbs have to do with it? Whatever. The first time, the second time, the third time. In short, the fourth time I listened to it. And from July, we come to October, to the 15th of October. We get to the 15th of October that I take off all insulin carbs from that day and start doing Life 120.
He starts following the Life 120 lifestyle. Then he does the tests again in November because the follow-up test was scheduled then.
Yes, it is because I have the control, yes.
What do you read on the analysis and what do you find?
I thought they were wrong, so much so that I repeated them twice. Yes, I said, these are not mine, these analyses, they were wrong for me. Here.
A hypothyroidism, so from hyper we went to hypo. So from one thing excessive to one thing.
A mild hypo in a subclinical state, let's say.
Yes, and the two hormonal factors, how do you find them?
I don't remember. I remember the TSH.
That is a factor anyway. You go to the doctor, and what does the doctor tell you?
It is splendid, because he finally said it is better hypo and not hyper. So at least we are sure that we don't even do radioiodine, even though he still says that this improvement was really due to radioiodine.
And still he says this. In the meantime, however, she continues to take the medications.
He takes
and then
them away,
gradually,
however, he reduces them for me. He reduces them to me, yes.
Because the levels of TSH and hormonal factors stabilize, and then you reduce them. You told us that he was taking 3 pills a day to keep this condition under control. Now, how many tablets are you taking a day?
Half every other day.
So 1/12 of what she was taking before. One last question, Mrs. Mishoshia. You told us that you had problems with blood pressure, tachycardia, these types of symptoms. Are these types obviously still there, or do you have them?
The pressure is 80, 120, 70, 110.
La tachycardia?
There is no longer.
So we thank you, Mrs. Mishoshia, for being here, for talking to us, obviously, about your journey with Lifestyle Life 120.